Hangster OG here. Yes, I am wearing glasses, but I have them on because I did not want to miss any of the upcoming information that you're going to see in just a few seconds. Hang tight. Dr. Ali Hartman in the house. Joint health and flexibility starts now. So I want to officially welcome everyone to this very special Crush Your Mountain Wellness. Today, I have one of the most amazing people you can imagine in terms of wellness and taking care of your body and taking care of your health. If you are a person who is over 50 and you want to take care of your joints, you want to take care of your ability to flex, this is important for you to watch. Let me explain. Dr. Ali Hartman, although raised as a doctor of physical therapy, her true passion lies in prevention and health and promotion, getting upstreams of injuries and illnesses before they take a devastating toll on individuals, families, communities, and companies. Here, with Ali believes that all athletes, industrial or otherwise, deserve the tools, resources, and ecosystems to help them perform at their best. She is one of the founding business operators of the Proactivity company that specializes in particularly the movement, in terms of the ergonomics. She is a brilliant individual, and I'm privileged and honored to have her on this humble show. Dr. Alison Hartman, lovingly known by her patients as Dr. Ali. Welcome to Crush Your Mountain.
Thank you. That was such a wonderful introduction, and I'm honored to be here. I've been a fan of the show and watching episodes since the beginning, really. And I think it's an amazing endeavor, and you're sharing information that people need to know because it can literally, I've seen the information that you're sharing. I've seen it play out where it truly changes the trajectory of people's lives. So I think it's important work you're doing, and I'm honored to be here.
Thank you very much. If I don't know if anybody can see me blush, but I probably am at this point. Well, let me ask you this. What challenges do you see in middle-aged and older ones in your practice?
Wow, that's a big question, and one that I could probably talk about forever. I think the biggest challenges that I see are really those that are inflicted upon that population largely by my profession and my peer professions, the medical system. There's something, a term that gets thrown around a lot and has been, the awareness has become greater more recently, called ageism. And that's the concept that we sort of have these implicit biases about an aging adult. So whether they're in the older adult category or whether they're just in an age where they're progressing towards that, our behaviors, our language, our impressions, the little nuances in our behavior and our tones and the ways we phrase things changes to impart this belief on a person that as they age, that their body is sort of just destined to wither away. And if we've seen anything in the research, that is the opposite of the truth, that while there are changes that happen to a body as it spends more time on earth, right? The ones most obvious are the wrinkles that come on our face. And those same wrinkles happen on our insides, right? But we don't have pain associated with the wrinkles on our face, and we don't have to have pain associated with the wrinkles on our inside. So I think the biggest challenges that really impact the group that you're speaking about is the biases placed on them by the people they're going to for trusted information. You know, we oftentimes underdose adults in general as physical therapists and as rehab professionals. We give a totally different subset of exercises that don't actually get people stronger. We don't push people enough because of those implicit biases, and I believe it harms people, although indirectly it does harm.
Absolutely. You know, I'll tell you, I've been listening to a number of programs and podcasts like Tom Bilyeu and others, and one of the doctors on there made an interesting statement. He said that he's come to view age or aging the way we all experience it as actually a disease in itself that ultimately can be cured. But now, taking it one step further, you kind of touched on something interesting, and that's the mind-body connection. So we talked a little bit about flexibility. What is the mind-body connection between flexibility in our joints and how that plays out over time?
Sure, yeah. So the human brain is amazing. And there's a, if we think about flexibility in terms of how our brain has flexibility over time, that will get labeled a term neuroplasticity. It's this concept that throughout life, really, no matter what age category we're in, that our brain and its neural connections are constantly changing. And one of the most powerful ways that we can influence our brain's neuroplasticity is by using our body in different and varied ways. So, flexibility and mobility work being one of those things. Our body is literally a machine that's built to adapt to the stressors that we place it under. So, when we spend time taking our body through its full ranges of motion, pressing into areas of limitation to improve our mobility and flexibility over time, not only do we impact that tissue, but essentially we're training our brain. We're kind of remapping that area of our body within our brain and teaching our brain how to access those pathways, and how to better access all the muscles in the area, and to improve what's called proprioception, the body's awareness of where that joint is in space. And all those things, when we kind of take the body changes that happen when we dedicate to whether it's mobility or flexibility or strength or movement in general, we take the body benefits that happen at the local tissue and put that together with the changes that are happening in our brain that come from just going through full ranges of motion throughout our life. And it builds this really powerful union where our body is capable of doing its full ranges of motion throughout life, and the brain knows how to program the muscles to access that range of motion. So I think it's a huge connection, and one that I do think is becoming more, widely understood and recognized as we go through the years.
How does one's internal dialogue, affect that range of motion as well?
Yeah, that's amazing. Now we're getting into kind of my other passion area, which is if we pull things from sports psychology, right, and things like self-talk and mantra and things that professional athletes have been using for decades, right? The top level Olympians will all tell you that their mental game is just as important as their physical game. The things they're saying to themselves, the dialogue they have when they're competing or when they're training. And, there's a tremendous amount of research on that stuff and how it literally impacts performance. So when we do the same cycling task, one group not saying anything to themselves and one group repeating a positive mantra in their head during the whole thing, the same individual can perform statistically significantly better under the trial where they're repeating that positive phrase. So if we carry that research over, then I think it makes total sense that the things that we're saying to ourselves about our body, that internal dialogue that we have, one being positive, being that my body is capable, that yeah, maybe there's some pain or some stiffness, but my body is amazing at adapting, and it's going to adapt if I'm just patient and persistent over time. I think all of that is what makes or breaks. I was talking to someone this week and I said, if we can approach our body and our experience within our body and kind of the aches and pains or the areas of limitation or the things we're working on with a sense of curiosity, then a person that approaches their body and what it's trying to tell them with a sense of curiosity, to me, is a person who's going to be a successful kind of user of this machine for their whole life, because the body is simply trying to tell us something at all times. It's using whatever methods it has. And so we need to be able to respect, listen to our body, and have an internal dialogue with it back to one that is framed in a positive outlook for us to be able to be successful long term.
Would you